Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over why it is so important to debride wounds that have devitalized tissue. Okay, we need to debride these wounds. So that is exactly what I'll be going over. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So when we're talking about wound management, okay, it's super important that we are preparing the wound bed, managing moisture and exudate. But another big portion is that tissue viable? Okay, if the tissue is not viable, we need to get rid of it. Okay, so that's where debridement comes in. And there's so many different debridement methods that we can choose from. So really, there's something for everybody when it comes to a debridement method. Now, why do we need to get rid of this non-viable tissue? So it actually creates a nutrition source for bacteria. Okay, it inhibits the wound from healing. So that's why we need to get rid of it. When we see a wound base, we want a just nice, clean, pinky, ready, just nice granulation tissue. Okay, that's what's going to heal. And devitalized tissue, it's going to almost form a barrier over that wound to prevent reepithelialization. Okay, so it's going to prevent it from actually healing. And then if we're using any topicals on top of the wound, it's not going to penetrate through that non-viable tissue. Okay, so we can't treat a wound if it has non-viable tissue on top, because then we're not actually treating the wound. So it's like you're treating a scab, and without using some sort of debridement method on top of that, we're not doing anything. So it also it has a cover over the wound, so then we're not able to fully assess the wound, the severity, the extent, like how deep is that necrotic tissue, how deep is that wound, and like you don't know if you have non-viable tissue over top of it. That's why we need to get rid of it. So I did go over a few of these in the last slide, but I'll just go over them again. So benefits of debridement. So it's the removal of devitalized tissue to prevent or limit potential negative effects on wound management. Okay, so if we're removing the devitalized tissue, we're removing the potential source of infection. We're removing local infection. We're decreasing bioburden. We're then able to actually obtain an accurate culture. Okay, so when we swab the wound, we don't want to be swabbing a scab or this devitalized tissue, because of course it's going to have so much bacteria in it. It's just a breeding ground of bacteria. So we want to remove that, and then we can actually take an accurate culture to see what type of bacteria is there. Do we need to treat it? Okay, it will also stimulate the wound bed to promote healing. So wound debridement is super, super important as a treatment strategy for effective wound management, especially if we're dealing with a biofilm. Okay, so we do have different debridement methods. So sharp debridement, this is where you would use like a scalpel or a curette to remove devitalized tissue. Now, this is the quickest method. It can cause some pain. And then we have autolytic debridement. This is where we're using the body's own enzymes to liquefy devitalized tissue to remove it. Enzymatic debridement. This is using external enzymes. So that would be like Santal, okay? That's the one that we would use for an enzymatic debridement to remove. It's very similar to autolytic debridement, but you're providing the enzymes, okay? Biological debridement, this you're using sterile maggots, okay? They're honestly great though, because they don't touch any vitalized tissue. So they only clean out the devitalized tissue. It's painless. It's honestly, I'd say one of the best methods that is not commonly used. And it's not commonly used because we have to use a sterile bottlefly larva. And they're hard to get. I know where I'm located. It's definitely not something we use, okay? But it is a really good method. If people can get over the fact of it's a maggot in your wound. Then we have mechanical debridement. So this is more like your wet to dry dressing, pulling it off. I don't like this method whatsoever. I've said this many of times in my debridement videos. I don't like it because, for one, it's so painful. Imagine pulling off a bandage and it pulling dead tissue, good tissue. It's non-selective, so it's going to pull whatever tissue it's attached to. So not my method that I ever choose. It's not something I choose. And then debridement it's considered a standard approach in wound care because it's getting rid of the necrotic tissue. It's reducing bacteria. It stimulates the wound to start healing. Okay. So this is what we always need to do if you have devitalized tissue, is debride. Because there's so many different types of debridement methods, and there's even all different types of devitalized tissue, right? So we're going to have to look at the whole wound when we're looking at it, when we're choosing what type of debridement method we're going to use. And it should be based on the following. So the location of the wound bed, the depth, the peri-wound area, vascular health. So vascular health, I want to touch base on for a second, because if you have a necrotic wound caused by lack of blood flow to that area, we never want to remove the devitalized tissue, okay? As long as it's stable, we keep it dry and we do not remove it, okay? Because it'll do more harm than good in wounds that don't have proper blood flow to that area, okay? So sometimes when we have arterial disease or even in diabetics, we have to be super, super cautious removing devitalized tissue. Okay, we want to look, is it a chronic wound? Is it an acute wound? And then the level of skill of the individual to change the dressing. So say we're doing like autolytic or enzymatic debridement, can the patient perform the wound care to the extent of where the debridement's actually going to work? Okay, so we got to keep that as a factor. Patient nutrition, exudate level, how much drainage is coming out of that wound. So all these need to be factored in when we're choosing a debridement method. We also have to factor in other comorbidities and the opinion of the patient. What do they think? Like, what is their thoughts on the debridement method? They do have to be able to have a choice too. So we have to know that debridement is the best way to get those wounds to heal. Even though some wounds, they take months and months to heal, these chronic or complex wounds, but with the right debridement and the right care of that wound, they can heal. So I hope this video did show you the importance of debridement and why we need to be debriding these wounds with devitalized tissue. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.